My subject is nuclear medicine and thyroid, a historical perspective. I think I get older that they give me such a subject, but I try to manage it in the next 30 minutes. You will see a lot of information, many dates. I hope it will be interesting also for you in the way that I produce this presentation. Nuclear medicine is an unique specialty within medicine that combines the principle of physics and especially the atom theory and the use of radioactivity according to the rules and ethics of good medical practice. There is one question if you are going into a historical perspective. How old is nuclear medicine? Can we define this? The two great ancient Greek philosophers, Democritus and Hippocrates, formulate theories that led to the discovery of radioactivity, Democritus, and the basics of practicing medicine according to rules and ethics, Hippocrates. What does Democritus say? That an infinitive number of indivisible and undifferentiated substance, still devoid of quality and classification, are carried about, scattered in the void. When they approach one another or collide or are entangled and aggregate, appear as water, fire, plants, or humans. But all things really are made up of this indivisible atomic form and nothing else. Είναι δε πάντα τας ατόμους ιδέας υπ' αυτού καλουμένας έτερον δε μηδέν. And Hippocrates says that if man were to be a single entity, he could never feel any pain. Be a single entity, there will be no reasonable cause of such pain. And if, in spite of this, he could feel pain, there will be only one possible therapy. In fact, the possible treatments are so many because the parts of the body are numerous, and when they warm and cool or dry and moisture each other in an unnatural way, they generate illness. For this reason, there are different kinds of disease and various are the treatment of this disease. Ώστε πολέμεν οι δε των νουσιμάτων, πολλοί δε και η ίηση αυταίων εστί. How old is nuclear medicine? The question again. According to a legend, these two great men met in one occasion. They lived in the same time. We don't know whether they fused their ideas, but if they did so, nuclear medicine will be one of the oldest medical specialties at about 2,500 years old. Many of this story and many other exciting stories you can find in the book that you received today in the morning, fusing the idea of Democritus and Hippocrates. Iodine is in my opinion, the most important substance that we have in nuclear medicine. It was discovered by Bernard Courtois in 1811 while routinely processing the ash from seaweed. He released a curious violet vapor that condenses into attractive crystals. Gay-Lussac named in the same year the vapor discovered by Courtois iodine. The name origin is Greek and is iodes, the violet. And a few years later, Jean-François Goidet in 1820, he introduced the use of this iodine in the treatment of goiter. Long before this, however, and I'm coming back to this, it has been unknowingly used for this purpose in the form of ash from sponges. There is a lot of isotope of iodine. I'm not going now in details on this. As you know, the iodine metabolism is absorbed, the iodine is absorbed from the gastrointestinal tract. We need approximately 150 microgram in daily base, and the concentration of iodine within the thyroid cells is done using sodium iodine pump. The thyroid cell has the ability to concentrate 20 to 40 times more than in the blood, and iodine between other sites secreted by the stomach and salivary glands, extracted in the urine, sweat, and feces. And here is a schematic about the iodine metabolism. Goiter. Who described first? We are coming back to Hippocrates. In one of his books, The Glandules, he said, when glands of the neck become diseased themselves, they became tubercular and produce stroma. As you know, is something that we are still using this word. And we have another one word. Aurelius Celsus was among the first to differentiate between the various forms of tumor of the neck. He defined the enlargement of the neck as bronchocele, describing it as a tumor under the skin on the larynx, which is fleshly only or may contain some sort of honey-like substance. He clearly defined cystic goiter. 2700 before Christus, Emperor Shen Nuang's prescription mentioned the use of seaweed for the treatment of goiter. Little bit later, or more later, 40 before Christus, Plinus, Vitruvius, and Juvenal described the prevalence of goiter in the Alps and the use of burnt seaweed for treatment. Also, Roger of Palermo is also described the use of ashes of sponge and seaweed, a source of iodine in the treatment of goiter. Goiter was usual in that time, and of course, influenced also the art. As you can see here, from an icon of the St. Catherine Monastery in Mount Sinai, you can see here clearly that is a diffuse goiter on the right lobe of the thyroid. And in 1500, Leonardo da Vinci recognized and drew the thyroid gland. Anatomy. Andreas Vesalius in 1543 provide first anatomical description and illustration of the thyroid gland, as you can see in this illustration here. Even though it was the name not given at that time, 1563, Eustachius introduced the term isthmus to describe the tissue connecting the two lobes of the thyroid. In 1656, Thomas Wharton named gland thyroid after the shape of an ancient Grecian shield, which is called in Greek thyreos. Thyreoides is like a thyreos. This about the anatomy, about the names, but later they start to describe in a scientific way the thyroid disease. And I will mention names that you know. Is Robert Graves described in 1834 a syndrome of palpitation, goiter, and exophthalmos in 3 women. And it was given as clinical lecture and published in this year. About the same time, in 1840, Karl Adolfo von Basetov described the exophthalmic goiter in the Wochenschrift vom Heilkunde. That's why in the English speaking, they are talking about Graves' disease, and in Germany and Central Europe, they describe as Basetov disease, even though the first description, it was a little bit different. Nowadays, they describe this situation. Hypothyroidism and how to treat them. 1891, one of the ways to treat hypothyroidism and myxedema was the use of thyroid extracts. And they describe a case of myxedema treated with great benefit by feeding with fresh thyroid glands. A very elegant way to treat hypothyroidism. Thanks God we have a different way those days. What about the thyroid surgery? The first time is a description in 1961 from Abul Qasim, personal physician to Caliph el-Hakim III of Cordoba, who described the thyroidectomy for goiter, and he performed also a needle biopsy of the thyroid. I don't know if it's true, but it's the description there. Giovanni Morcani in 1761 is Giovanni Morcani of Padua, was the first to do something which has become routine today. He did autopsies to relate the patient illness to pathologic findings after death. This laid the foundation for scientific oncology. And he described in his major textbook on the site and cause of disease. John Hunter suggested that some cancers might be cured by surgery and described how the surgeon might decide which cancer to operate on. If the tumor had not invaded nearby tissues and was movable, he said, there is no impropriate in remove it. And in year 1791, he removed a large right side thyroid mass, 5 inches in diameter, in a female patient at the Hotel Dieu. It was performed by meticulous dissection and ligation of the superior and inferior thyroid arteries, a remarkable procedure to perform without anesthesia. The wound healed slowly, and the patient left hospital completely cured on the 34th postoperative day. Little bit different like today. One of the great surgeons of thyroid was Theodor Kocher from Bern. His technique became popular and was published widely. By 1882, Kocher's mortality rate was 2.4%, and by the end of 19th century, this rate was as low as 0.18%. Kocher had over 5,000 cases by the time of his death in 1917. But he was not only performed the surgery, but in one publication about goiter dissection and its consequences, über Kropfextirpation and ihre Folgen, he described the myxedema after the dissection of the goiter, and he published also some pictures. There is 2 sisters, one the goiter or the thyroid was removed. Here we have also, and you can see the difference in the growth. And here this man has this large goiter which was removed, but you can see on the face that is myxedema. Kocher was awarded the Nobel Prize in 1909 for his work on the thyroid gland. Treating the people with fresh thyroid gland was not so practical, and the discovery of thyroxine by Edward Calvin Kental in 1919 was very important steps to recognize the function of the thyroid, of thyroxine. And Kendall received also the Nobel Prize for Physiology or Medicine in 1950. And in 1928, Harrington and Barker synthesized thyroxine that we have today to treat the people with myxedema. Talking in an IAEA course about nuclear medicine, radioactivity is a very important part of our specialty. And of course, talking about radioactivity, we know Maria Salomea Slodowska. You know this name, I'm sure. Nobody? Is Madame Curie. Her achievements include a theory of radioactivity, a term that she coined it, techniques for isolating radioactive isotopes, the discovery of two elements, polonium and radium, and under her direction, the world's first studies were conducted into the treatment of neoplasm using radioactive isotope. Not only discovered this, but she received 2 Nobel Prizes, 1903 in physics as the first woman that ever became a Nobel Prize, and in 1911, the Nobel Prize in chemistry as the only person that received a second Nobel Prize in 2 different subjects. In 1924, George Hevesy introduced the concept of radioactive tracer for the study of metabolic pathway, and he received the Nobel Prize for this work in 1943. It was a story, I don't know if it's true. Von Hevesy was trying to see if his house lady was using the potatoes of the previous day in the mashed potato of the next day. That's why he put a little bit radioactivity into the potatoes, and next day he get mashed potato into his laboratory, and he discovered that indeed the house lady was using the potatoes of the previous day to make the mashed potatoes. He, of course, went to her and say about his discovery, and he was dismissed from the house. 1934, a very important production, Enrico Fermin produced the iodine 128, and he became the Nobel Prize in Physics in 1938. And I'm coming back again to this table. We are using the first historical is 128 with 25 minutes half-life, but nowadays we are using 131, the 123, and for positron, the 124 from these isotopes. On November 12, 1936, in a luncheon meeting at Harvard Medical School, Dr. Saul Hertz asked Dr. Carl Compton if iodine can be made radioactive artificially. Compton didn't want to reply at once and told Saul Hertz that he will send him a letter. And December 15, 1936, Dr. Saul Hertz received the letter from Carl Compton that say iodine can be made artificially radioactive. It has a half period of decay of 25 minutes, talking about iodine 128, and emits gamma ray and beta rays with a maximum energy and so on. It is probable that there are several other periods of decay, but if so, they correspond to type of radioactivity like the one indicated, and they are not as yet very definitely established. Saul Hertz came excited about this, and he replied, I received your letter in relation to the radioactivity that can be artificially induced with iodine, and believe the data will be of considerable interest to us as we intimate to you. The fact that iodine is selectively taken up by the thyroid gland when injected into the body make it possible to hope that iodine, which is made radioactive and which loses its radioactivity as rapidly as you indicate, will be a useful method of therapy in case of overactivity of the thyroid gland. 1936. 1938, the first paper appears on the possibility of studying thyroid physiology by use of radioactive iodine. And in May 11, 1946, Saul Hertz published in the Journal of the American Medical Association, the JAMA, radioactive iodine in the study of thyroid physiology. 1942, it was learned that individuals with normal thyroid glands fail to concentrate iodine-131 in malignant thyroid tumor. And in 1946, in the United States, the first treatment with radioiodine were performed, and the results indicate good response were presented in the JAMA. This is the same paper that Saul Hertz was described, the study of physiology. It was the use of radioactive iodine therapy in hyperthyroidism, and also from Chapman and Evans in the same publication, in the same journal, 11 of May 1946, the treatment of hyperthyroidism with radioactive iodine. Here is Saul Hertz using a multi-counter to analyze the distribution of radioactive iodine in patients in early 1941. And Saul Hertz was the first physician apply iodine-131 to a human. This is just a hint. In 1949, in a newspaper in New York, the Courier Mail, it was written, "Atomic cocktail as cancer cure." And it was based on the presentation of the paper of Seidlin and al. In the American Medical Association about the effect of iodine-131 on functional metastasis of adenocarcinoma of the thyroid. In 1949, in the October issue of Life, it was an article with radioiodine helps one type of cancer, radioactive chemicals bring about history-making recovery of patients died from thyroid tumors, and they publish also the picture of Mr. Bernard Bernstein in 1942 here, and as he looks today, that today was 1949, you can see in 7 years that the man was almost cured. In 1947, Cope, Rawson, and MacArthur report first use of radioactive iodine to demonstrate a hot thyroid nodule. And in 1951, Taffy and Fitzgerald call attention to thyroid cancer in children following head and neck irradiation. We have seen also the results of this irradiation after the Chernobyl disaster. One very important element is technetium, which was discovered by Senor Emilio Gino Segre, and who was his doctor father? It was Enrico Fermi, who discovered the iodine-128, and his doctorate was discovered the technetium together with Carlo Perrier. What is the name of origin? It is named after the Greek word technitos, meaning artificial. Technetium was the first element to produce artificially, and it has not been found in nature and appears to be appropriate name according to technitos, artificial. In 1958, the first technetium 99M generator was built, and you can see here the way that the pertechnetate solution is evaluated from molybdenum bound. This is the generator almost in the way that we know today. Positron. The existence of the positron was postulated by Paul Dirac in 1928 and later seen experimentally by Carl Anderson in a cloud chamber in 1932. Both of them, 1933 Paul Dirac and 1936 Carl David Anderson, received the Nobel Prize in Physics. But the positron could be also produced artificially, and it was described by Irene Curie, the daughter of Marie Curie, and Frédéric Joliot, her husband. They show in 1934 that positron-emitting radionuclide could be produced artificially, and Irina became also the Nobel Prize for Chemistry in 1935. And the creation of man-made radioisotope was facilitated by the development of cyclotron by Ernst Lorentz, and surprising, he received also a Nobel Prize of Physics in 1939. Everything will be useless if we don't have the instrumentation. Instrumentation is very important in applying nuclear medicine to humans and also for the thyroid. In the early days, scans were performed by manually positioning a simple Geiger counter above the organ of interest. An improvement in sensitivity came with the development of the scintillation detector and scanner by Kaysen in 1951, and the major breakthrough followed with the invention of the anchor scintillation camera. The anchor camera viewed the entire organ of interest at one time. Here is a measurement of radioiodine uptake. They measure above the thyroid, make their calculation of course, in written form to find the uptake. And here is a manual thyroid scan. The map of a manual thyroid scan obtained through 3 hours of work by performing measurement with a single channel detector applied to different areas of the thyroid region, and you can see that they make a drawing that show approximately the shape of the thyroid. Thanks God, Anker found the Anker camera. This is the prototype, and this is Hall's Anker. We know that one of the important things in nuclear medicine is the single photon emission tomography, and the first publication was 1st of May 1965, which is written, it appears feasible to consider seriously the full 3-dimensional mapping of radioisotope distribution in a variety of clinical situations in view of the increased sensitivity of the camera device and the increased number of countable photons available for short-lived emitters. And of course, over and above, we have nowadays the SPECT-CT, which was first described in 1992 in the Journal of Nuclear Medicine, description of a prototype emission transmission computer tomography imaging system. And here you can see a schematic drawing of the equipment. And here is the radiographic hole pattern, the CT pattern, and here the radionuclide that they compare it. And another one important step in nuclear medicine and the history of nuclear medicine, including the imaging of thyroid, is the positron emission tomography known as PET, which the first name was PET with 2T, is a positron emission transaxial tomography for nuclear imaging, and it was first published in Radiology in January 1975. And here are some pictures of this prototype and the phantom show in the turntable. I'm coming to the last slides. I'm asking once again, how old is nuclear medicine? If the two great ancient Greek philosophers, Democritus and Hippocrates, in their meeting, did not fuse their thyroid, the theories, then the first therapeutic use of artificial produced radioisotope occurred in Christmas Eve of 1936, and nuclear medicine is 79 years old. I have two conclusions for this presentation. Also preparing the presentation, the scientists who were dealing with radioactivity won a lot of Nobel Prizes. And conclusion two, I don't know who of you know the movie My Big Fat Greek Wedding. I was feeling in my presentation that Gas Portokallos, that everybody say, every time say, you know the root of the word is a Greek word. Thank you very much for your attention.